Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. I'll now turn the briefing over to Dr. Garza. Thank you.
Okay, thank you. Good afternoon, and thanks everybody for joining us today. So a couple of things. We continue to see some increases in our patients coming from our rural areas, which is really what's keeping our admissions and our census numbers up above where we would like to see them. Locally, the cases are not as much coming from St. Louis City and St. Louis County as they are from the more outlying areas like Jefferson County and Franklin County, where we're seeing both a rise in cases and in hospitalizations. So mitigation factors like wearing a mask, social distancing, we know that these things can dramatically decrease the number of cases we're seeing in these communities. And it's worked in the city, it's worked in the county. So I strongly urge everybody watching, no matter where you live or what mandatory policies are in place, to wear a mask when you're out in public and to wash your hands and to stay away from those large crowds. It's through these efforts that we can interrupt that transmission and get those hospitalizations down. It's going to be really hard for us to gain control over the virus unless we can all contribute to bring those numbers down. Now, we'll update our admissions data to show where they're coming from on a weekly basis, much like we update our case data. And as you remember, we showed our admissions data last Friday, so we're going to continue to update that slide. So now let's move over to our data and see where we are today. So as you know, we start off with our admissions data. Our number today has been climbing a little bit closer to that 40 mark. You'll see here that we're at 39 admissions. That brings our 7-day moving average up to 38. So that's up 2 from Monday. So as you recall, we've seen this 7-day rolling average decrease, and now it seems to be creeping back up. And so we'd like to see that decrease in admissions and like to see that 7-day average come back down. But unfortunately, we seem to be moving in the wrong direction now. Moving to our hospitalization data, again, here is the census of COVID positive patients in the task force hospitals. We have 284 patients hospitalized today with COVID-19, and that has remained fairly flat. Today, our rolling 7-day moving average is 269. So again, seems relatively flat as well. Updating you on some of the numbers. Again, this is for COVID positive patients only. Across our task force hospitals, as I mentioned, we have 284 hospitalizations today of confirmed COVID positive patients. We have 78 confirmed COVID patients in our intensive care units, and we have 50 confirmed COVID patients on ventilators today. These numbers really haven't changed much over the last week or so. Now, moving on to our suspected COVID positive patients. So again, these are patients where either COVID is suspected or we're waiting for a test to come back so we can rule out COVID. So we have 89 hospitalizations today of suspected COVID patients. We have 10 suspected COVID patients in our intensive care units, and we have 4 suspected COVID patients on ventilators today. Now moving on to our good news slide, we discharged 38 additional COVID patients from task force hospitals yesterday. That brings our cumulative total to 6,313 patients. Again, a shout out to our healthcare workers and the support people that helped them out to get our patients better and back home to their loved ones. So we have a pretty light slide deck today, but before we move on to media questions, or actually I don't believe there are any media questions, I want to talk a little bit about testing for COVID-19. And so there seems to be some confusion out in the community, particularly with either schools or with private businesses, about the need to retest for COVID once a patient has been diagnosed with COVID. You don't need to retest for COVID in order to come back to work or in order to come back to school. The CDC is very clear about this. This is what's called a symptom-based strategy. And so after you have gone through your 10 days of isolation and quarantine, have not had fever for 24 hours, then you're cleared to go back and resume normal activities. So you shouldn't require a repeat test to go back to school or to go back to work. And the reason for that is the test that we used to diagnose COVID-19 in somebody that's symptomatic or asymptomatic is what's called a PCR-based test. It's a polymerase chain reaction test, and what it does is it looks for genetic material from the virus. So all it can tell you really is that it's found genetic material. What it can't tell you is if the person is infectious or not. We know from the data that we have patients that can have dead virus hanging around that will have a positive test because they're still genetic material. However, they're not infectious, so they don't pass live virus on to anybody and they can't infect anybody. And so again, CDC is very clear about this. We don't need to retest people once they have cleared their quarantine for 10 days from when they became sick or from when they tested positive. What it does is it consumes valuable resources, valuable testing resources, and it's really completely unnecessary. So please refrain from doing that retesting in order to get back to work or back to school. So as we wrap up today, I just wanted to take this opportunity to remind everybody that October is the start of flu season, as you've heard us talk about many times before, and the best way to protect ourselves is by getting vaccinated against influenza. Your primary care office or places like Walgreens or CVS are all offering the vaccine. There are even free clinics happening all over town, and if you want to find one nearest you, visit vaccinatestl, all one word, .org, and you can find a list of these clinics that are happening all around the metropolitan area. So I can't stress enough how important it is this year, more so than ever, to protect yourself against the flu. Having two respiratory viruses circulating in the community at the same time is extremely worrisome. And we don't have a vaccine for COVID yet, but we do for the flu, so protect yourself against that infectious agent. Also remember that all of those other things that we talk about every day will protect you from the flu just like they protect you from COVID. So things like wearing a mask, washing your hands, not gathering in large groups, things like that will protect you and your loved ones from influenza as well as COVID. So that concludes our remarks today. I don't believe we have any questions from the media, and so we are going to go ahead and sign off. Thank you, everybody, for listening.